हेलो हाय आदाब सत श्री अकाल। एक बार फिर से आ गया हूं मैं आप लोगों के बीच, आपका हमराज आरजे अभिनव 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर। आज दोबारा से आप लोगों के बीच आ गया हूं नो योर फैकल्टी हमारा शो लेकर, जिसमें हम लोग आप लोगों के पास लेकर आते हैं एक फैकल्टी जिनके बारे में हम उनकी पर्सनैलिटी से रिलेटेड उनसे जुड़ी हुई काफ़ी सारी बातें जानते हैं। वो बातें भी जो स्टूडेंट्स को नहीं पता होती हैं, वो बातें जो शायद उनके कुछ खास दोस्त जानते हैं लेकिन कलीग्स को भी नहीं पता होती हैं कि वो क्या देख रहे होते हैं, क्या उनकी हॉबीज़ हैं, क्या उनको पसंद है। तो इसके बारे में आज हम लोग ऐसी ही एक चर्चा करेंगे। जिस शख्सियत से ये हम बात करेंगे, जिनके बारे में चर्चा करेंगे, उनके बारे में मैं पहले आपको कुछ बातें बताऊंगा और उसके बाद हम लोग उनका इस्तकबाल करेंगे, उनको वेलकम करेंगे। जी हाँ, मैं बात कर रहा हूँ स्कूल ऑफ अलाइड हेल्थ साइंसेज के डायरेक्टर की, डॉक्टर प्रकाश रोपलेकर जी, जिनके बारे में मैं कुछ बातें आपको कहता हूँ। डॉक्टर प्रकाश रोपलेकर इज डायरेक्टर ऑफ स्कूल ऑफ अलाइड हेल्थ साइंसेज D.Y.Patil डीम्ड टू बी यूनिवर्सिटी। डॉक्टर रोपलेकर इज MBBS MD Pathology DCP graduated from Government Medical College and Hospital, Aurangabad, Maharashtra. Dr. Prakash Roplekar is ex-professor and HoD Pathology Department, D.Y.Patil Medical College. Worked as faculty in Pathology Department, Grant Medical College and Sir J.J. Hospital, Mumbai for 27 years. Faculty at KG Somaiya Medical College, Sion, Mumbai for 5 years. Total teaching experience in pathology is 45 years. Presently Director AHS in DYPU 4 years. Dr. Roplekar is interested in academic activities, teaching, guiding students in the field of pathology and hospital services in general in different branches, motivating students in the field of allied health programs. He is interested in gardening, जिसके बारे में आज हम जानेंगे सर से, इंटीरियर डिजाइनिंग एंड लिसनिंग टू म्यूजिक, ओल्ड हिंदी सॉन्ग्स एंड इंस्ट्रूमेंटल म्यूजिक। सर, आपका बहुत बहुत वेलकम करता हूँ, इस्तकबाल करता हूँ। कैसे हैं सर आप? गुड मॉर्निंग।
थैंक यू, गुड मॉर्निंग टू यू अभिनव।
सो मच। तो सर, सवालों का जो सिलसिला है उसकी शुरुआत करते हैं। टेल अस अबाउट योर जर्नी हियर एट D.Y.Patil यूनिवर्सिटी। व्हेन डिड यू स्टार्ट वर्किंग हियर एंड हाउ हैव यू इवॉल्व्ड एज अ टीचर एंड ह्यूमन बीइंग?
No, I started working in D.Y.Patil deemed to be University since 2014. After I worked at Grant Medical College, J.J. Hospital, and subsequently in KJ Somaiya Medical College, where I was faculty as a postgraduate teacher and an undergraduate teacher.
Wonderful.
I joined D.Y.Patil deemed to be University Department of Pathology in 2014 as Professor of Pathology. I worked for almost 7 years, and at the time of retirement, as per the guidelines of the MCI, the retirement age is 70 years. I was shifted to academics of allied health sciences as director, because this is an administrative post, and the management wanted that someone senior to take over this post, so that the branch of allied health science will progress in this university.
Wonderful, definitely. So actually they contacted with you and finally you came here. Sir, what made you choose the field of allied sciences? How did you prepare yourself for this since school and college days? I mean, मतलब आप शुरू से ही चाह रहे थे कि मैं इसी फील्ड में आऊँ?
Since I am working in the subject of pathology, pathology is related with the diagnostic laboratory services, which each and every patient has to undergo. Once he is admitted in the hospital services for any ailment, any treatment, or for any operative procedures, the laboratory investigations are absolutely essential, which are mandatory for each and every patient in the clinical medicine as well as in surgical side and all that. So pathology is a basic branch which helps for investigations as well as patient care. It also is related with the transfusion medicine, which is one of the branch of pathology subject.
Wow.
And that is how I developed this interest, and since most of the programs which are run by D.Y.Patil deemed to be University, which started in the year of 2012, we are having 11 programs for undergraduate and almost 8 programs in the postgraduate department of BSc and MSc allied health programs of this university, and they are all related with the hospital laboratory services like radiology, anesthesia, laboratory services.
Great, wonderful.
DMLT courses. Then we are also having for cardiac perfusion, cardiac technology, kidney dialysis, and so on, including Bachelor of Physician Associates. This is most important. Most of the students are preferring to go for Bachelor of Physician Associate. This is a graduate as well as a postgraduate course, wherein the students are trained and they become an assistant to the clinical doctors for physicians, and they help them to find a bond between the patient as well as in the clinicians to help them for all the services that they render to the hospital places.
Okay.
So that is all about this.
So actually so much feathers in one cap.
I
जिम्मेदारी ज़्यादा और बोझ
I have
ज़्यादा.
3 faculties with me. One who is a clinical surgical professor in surgery department. He is my clinical associate for all these programs.
Great.
I also have a faculty for optometry department.
Nice.
I have a faculty for kidney dialysis to teach as an expert
Gee,
to
wow.
these programs. And we are also newly appointing few of the experts in the different program that we have, so that they will be responsible for hands-on training to the students when they go for second year, third year, as well as during their internship program of our university.
Wonderful. There is also one question. Dr. Patil is an inspiration for all of us. How has he motivated you?
It is the Chancellor and the President, Dr. Patil sir, of this university. He is always interested in students' progress, students' activities, overall growth of the students in all the fields, not only the particular subject or the degrees that
Correct.
he offers, but overall he feels that the students should get developed in all the fields, extracurricular activities, programs like their own interest or sports.
Even
He
sports
himself is a
especially.
sports person.
Yes.
Therefore, he always encourages students to have good sports activities, and the ground, the cricket ground, the football ground, everything is available, and students take the benefit of that, and that is the most important part of Dr. Patil, to motivate the students in overall development.
Can you explain how advancement in allied sciences such as materials science and nanotechnology have contributed to breakthroughs in the field of renewable energy and sustainability? What are some notable examples?
Nanotechnology is used in most of the diagnostic fields. It is used in
wonderful.
radiology, it's used in cardiac perfusion technology. It's also used in other in other instrumentations and all that. And this definitely helps for the best diagnosis for investigations and all that in the patient care.
Allied sciences often play a crucial role in healthcare. Could you discuss the intersection of allied sciences like biology and chemistry with medical research and how it has led to improved diagnostics and treatments? जैसा कि अभी आपने mention भी किया.
Yeah, जैसे कि हमने कहा कि there are so many branches which are related in the hospital services, as I have already enumerated, like radiology, anesthesia, laboratory services of pathology department, transfusion medicine, kidney dialysis and all that. Most of these are all interrelated. See, these are all patient-centric courses, and somewhere the patient has to interact with these different departments, like radiology. He has to go for operation, so he should know about the anesthesiology. So all the students, those who are taking these courses, they are, although they are different, they are all interrelated, and it's a patient-centric. So that's most important. So the patient care is most important in our programs. And all these programs, although they are different, each one is having their own importance, and they choose that according to their liking.
Oh, wonderful, wonderful. So actually also they are having the practical experiences simultaneously. The field of computer science is closely tied to allied sciences. How has the integration of computer science and allied sciences like physics and engineering resulted in innovations in areas such as artificial intelligence, robotics and data analysis? Or maybe you can also tell us the emergence of artificial intelligence will affect the allied health sciences.
Most important is computers is important in all the branches that we are undertaking for these courses.
Correct, definitely.
Radiology, pathology, everywhere the computers are important. They play a major role.
Gee, sure.
Everything, the data analysis, their investigations, everything is charted into a computer. And even for diagnosis of MRI, CT, they need a computer knowledge, without which it is very difficult.
Yes.
So this all has helped medical science and allied health to progress to a greater extent.
Climate change is pressing global issue. How are allied sciences being employed to address climate-related challenges? I think, that's a very important thing and especially important topic, such as developing new materials for energy-efficient technologies and mitigating the impact of climate change and ecosystem.
Allied health mostly related with the hospital services, and whatever waste that we develop from the hospital side is properly disintegrated by using the incineration and all that. Okay. So we have got the arrangements for biomedical waste management. We have agencies which take the care of the biomedical waste which is segregated from the wards as well as from the operation theatre and all that. And this waste material is collected by the agencies and then it is incinerated in the industrial belt.
The intersection of allied sciences with the arts and humanities has led to unique interdisciplinary approaches. Can you provide some examples of how the convergence of these fields has enriched our understanding of human culture and creativity?
Human culture, as I've already said, that it is most important for having an integrity with different programs. So you must have very good relations with your colleagues who are working in the different branches.
Sure.
Like which I have enumerated. The different branches means different programs.
Different programs.
So you must have a very good relations with each and every colleague of yours, because once you are working with the hospital services, you need to approach to these different branches for the better patient care.
Sure.
For the patient care, he may require an X-ray findings at the earliest. He has to keep everything ready before the operation being placed tomorrow morning. So he has to have all the investigation done today. So he has to have better communication with his friends and his colleagues from different branches, so that he gets all the data which is prior, which is most important, so that he gives his information to the anesthetist who is responsible, as well as to the surgeon who is going to operate him in the next day morning. So these are all important, and this develops the human culture, which is very important.
So also it is very important to be a friend or have the friendly nature with your patients also?
Patients as well as their relatives also, because he is the link between the patient, between doctors, as well as the relatives, because he has to communicate what things are going to happen to the patient,
Yes.
what type of service, what type of operation is going to be done, how much time he will recover to post-operative care,
Sure.
and that all is done by these Allied Health Program students who are taking the training. They are all graduates and postgraduates, therefore they help in patient care as well as connecting with the physicians and consultants.
Consultant. Great. Nicely explained, sir. Okay, what makes our institution unique? I mean, of course, it's a faculty like us, definitely.
Most important, yeah.
But what about the factors such as infrastructure, cafeteria, lab and research facilities, the varied courses, and the general environment of learn and fun?
Most important, the program that we have started, it is at the behest of our respected Padma Shri Dr. D.Y.Patil, Dada Sahib.
Yes, Dada Sahib.
And subsequently it is taken over by Dr. Patil sir as the Chancellor and President of this university.
Yes.
And he was interested in saying that each and every student must learn to the best of his ability. And therefore
Wonderful.
we started large number of courses which are unique for this university. And most of the places we don't have it, except in the Government of Maharashtra University.
Agreed.
And in our D.Y.Patil University, we are having some other courses which are not run by even government agencies.
Wow.
So that's very important. And that is the reason why our university is best. Of course, faculty is best, because they are all the faculty teachers who teach MBBS graduates as well as postgraduates of the respective departments, and they are happily taking all the lectures to these program students.
Sure.
And they are also interested in their hospital services teaching and all that. That's very important. And it is the motivation of respected Vijay Patil sir as well as Shivani Patil madam, the Vice Chancellor and President and Vice President of our university. They take initiative in these programs to be developed to the greater extent.
Okay, what is the greatest lesson you got from your student or students?
Students are really, today's students are definitely, they are advanced. They know it much better. They are advanced in their computer knowledge. Sometimes they are extraordinary in their computer knowledge and all that. So it is the help from the student that we get most of the time in our programs to be developed, as well as whatever activities that they are doing, we guide them to that extent.
If you would have not be a professor, you would be?
I would have been interior designer and architect.
Actually, that was your hobby, and
my hobby
you wanted
is
to be
interior designer. My hobby is listening to the old songs of the Hindu movies, which I like most. I mean, for the last 60 to 70 years, all those are very good songs with beautiful lyrics that they have written, and that is worth listening. That's my hobby.
We will actually talk about that also, and I'm also asking some questions to you with your life. Okay, what do you do in your free time? As you have actually mentioned कि आपकी hobby ये रही है interior designing की रही है, old Hindi songs की रही है, gardening की रही है. How do you juggle your hobbies with your career? I mean, do you have free time for that?
Free time, I develop myself with the academics, whatever is there, whenever I get a time, as I'm interested. I try to do something related with the academics, and then I share that with my staff in my faculty, and we develop ourselves in our own department to the best of my ability, because it helps them also to learn what exactly,
Sure.
because they are also looking someone who can guide them. So I think I am better available here, so why not guide them to the proper extent and all that.
Wonderful. You are also listening the old songs. So, I
Old
mean,
songs.
Who are your favorite? I mean, Lata, Asha, Manade,
All those
Shankar
are the
Jagkishan,
masters of singers,
Mukesh,
like
Kishore, Rafi.
Lata Mangeshkar, Asha Bhosle, Mukesh, Manade, Kishore Kumar, Mohammed Rafi.
Muhammad Rafi.
Mohammed Rafi is the one who sings most of the hero songs, and when he sings, I can identify who is this hero because of his voice modulation. and all
Especially
that.
the
So
style
that's the
of the
plus point
performer.
of Mohammed Rafi.
Oh,
That's
wonderful.
very great.
What are the career opportunities for students of allied health sciences in India and abroad?
Most of these programs are hospital related, so they can work in established hospitals, or they can run in smaller nursing homes. If they are working in their own town or the district where there are small hospitals, they can be available there to the hospital services, or they can go abroad with the degree which is already recognized.
Sure.
And there is a registration which is to be available from state government, which process is there. Once they have a registration of these particular programs, they can apply abroad and take a job. Most of the students are working in Gulf countries and all that. They are better paid over there.
ग्रेट एक्चुअली दे आर वर्किंग देयर. और अब हम लोगों के पास है हमारा फेमस रैपिड फायर राउंड. तो रैपिड फायर राउंड में हम सर से कुछ सवालात करेंगे और आपसे जानेंगे कि आपके पास जल्दी से क्विकली कौन कौन से आंसर हैं. इनके लिए कुछ सवाल हैं आपसे. ओके. द बेस्ट एडवाइस यू गॉट इन योर करियर.
Myself,
यस.
be punctual,
ओके. बी
keep
पंचुअल.
the time and work accordingly. That's the most important thing which my professors always used to tell, and that is what I have imbibed in myself.
द हैप्पीएस्ट मोमेंट ऑफ योर लाइफ.
The happiest moment in my life is when I got a child which is bright. I have one daughter only, and she's working in computer services.
Oh, wonderful, like yours, especially like father, like daughter. The saddest moment of your
When I
life.
lost my parents.
Okay, I'm sorry for that. Challenging moment of your life.
Everything I take it as a challenge.
Yeah, every day
But
is a challenge
I
for you.
solve it. Though there is a challenging moment, I try to solve myself and overcome the challenge. Try and do it to the best of ability.
Okay, do you watch also the cinema? Which actor is your favorite?
Amitabh Bachchan.
Okay, never only lock किया जाए, sure. Okay, your favorite book?
Favorite book is my subject of pathology.
Maybe in your subject of pathology or actually fiction, non-fiction, whatever you want to read.
Most of them, the books that I like are only medical related, which I like best. Maybe, although I am pathologist, I like to read medicine, I like to read surgery,
Okay.
other subjects also, because it gives more information in today's medical field.
Apart from that, actually, you don't read.
No, I don't
novel
like
or
to read any
stories.
drama or stories and all that. No, not much of a time is there, so I don't want to go for that. I love music. I listen to the songs.
Oh.
So that is my pastime of listening to the songs.
Okay. Favorite movie? You're the Amitabh Bachchan fan, so you have watched a lot of movies.
Diwar and Trishul.
दीवार and त्रिशूल. अच्छा, त्रिशूल actually I like it so much.
Yeah,
दीवार के अलावा
editing
त्रिशूल की
है.
एक अलग
त्रिशूल is
कहानी
best.
रही है. Yes. Favorite food?
Favorite food? Vegetarian. Pure vegetarian food.
Favorite holiday destination?
Anywhere where there is hill station and all that, I like hill stations. Most of the places, wherever hill station is there, I love it.
You're the mountain guy.
Yeah.
And then, okay, there was our rapid fire round. और अब इसके बाद कुछ insights है जो आपसे हम पूछेंगे और जानेंगे उनसे related कुछ सवालों के जवाब आपसे. An idea that changed your life.
The idea was I would have retired, but then the motivation by our respected president, then my friends and colleagues that you can do best. So that was the thing. Therefore, I continued in these academic activities of our university.
Then actually at that time you dropped the idea कि अब मुझे retire फिलहाल नहीं होना है.
Yeah, then I thought, I better don't retire because most of the people still work at the age of 80 years.
Sure, definitely.
Then why not I work at the age of 73 years?
We are
That
lucky
is the
actually you to have you. वो सही फैसला लिया आपने कि आपने अभी retirement नहीं लिया था. Okay, how success has changed you?
Yes, it has definitely changed my image. This success, wherever I have worked, definitely people have appreciated my ability, my capability,
Okay.
as well as my personality. And they have motivated me, and therefore I am continuing. That's the only thing.
Best role of your life? Father, son, husband or teacher?
Teaching.
Teaching is the best. अच्छा और father और son actually you give them same importance कि
Yeah,
मतलब
same
मैं करता हूँ
important,
ठीक उस जगह भी.
Members are members, family members. Everybody is important.
Okay. और husband का तो मतलब यही है कि वो कभी perfect हो नहीं सकता. Something like that. Okay, तो आपके हिसाब से अभी भी आप perfect नहीं हो पाए हो और
Perfect हो
certificate
ही नहीं
मिलता
सकते.
है.
Perfect हो भी नहीं सकेंगे.
Okay. Okay. Do you cry sometimes?
I don't cry because there is no point in crying. I try to overcome that crying or sad moment and try to control. That's all.
Okay. So actually, if you do, so you do it alone or
No,
what?
I don't
You
know
don't
at
actually
all.
show it.
There is no need.
Okay.
Why to cry?
Okay, great. What hurt you the most then? What hurt?
If
hurt?
somebody is trying to give an adverse comment, despite the fact that the things which are going in a proper way, it hurts. Otherwise, I don't care. Even if something goes wrong, I don't care.
Okay, so it was the insights of his life और सर से अब हम कुछ पूछेंगे this or that round. Though I have some answers, मुझे कुछ के बारे में पता चल गया आपसे बात करके, लेकिन कुछ के बारे में हम पता करेंगे. Okay, वेज और नॉन वेज?
Pure veg.
प्योर वेज. Okay. जिम और योगा?
Yoga.
अर्ली राइजर और नाइट आउल? मतलब
Early rise. I get up in the morning at about 4 o'clock daily. Still.
Then you do your yoga and
Yeah,
meditation.
then routine,
and all.
whatever it is.
Okay. Emotional और practical?
Practical.
Books और Kindle?
Books.
Books. Mountains or beaches? We know you are the mountain guy.
Mountains. Beaches also sometimes.
Okay, sometimes. For a change, especially.
For change, where it is available.
Okay. Religious or spiritual?
Religious.
Library और classroom? I mean, आपके लिए कौन सी ज़्यादा
I
suitable
would
जगह?
prefer classroom
Classroom.
because you can have an interaction with the students and all that. That's most important.
Okay. Amazon Prime or Netflix? What do you watch? If you watch?
Amazon.
Amazon Prime. Okay. Okay. Mukesh or Arijit Singh?
I would like Mukesh because he's an old-time singer,
Old-time singer.
wonderful singer. Most of the heroes he has given his beautiful voice.
And-
So I would prefer Mukesh, although Arijit is also good and he is for the younger generation.
Okay, in between actually, especially you are going to choose with Mohammad Rafi or Mukesh or Kishore, whom will you choose?
Mohammad Rafi.
Okay. Anytime actually you'll go with
Anytime
him.
Mohammad Rafi.
Any favorite song of his? I mean,
So
दुनिया के
many songs
रखवाले
are
और
there.
या शम्मी कपूर साहब के लिए जो उन्होंने गाया है अलग से गाने
Mohammad
या कोई-
Rafi's voice is recognized as Shammi Kapoor's voice.
हाँ.
And Shammi
Deewana wo
Kapoor
badal.
had beautiful songs in most of the movies. And you want me to give some lines
Oh,
of
sure,
songs
wonderful,
and all
wonderful.
that?
We
But
would love to.
I won't remember right now offhand.
Okay.
But then
आसमां से आया फरिश्ता प्यार का सबक
नहीं,
सिखलाने.
सुभान अल्लाह है हसी मेहमान है सुभान अल्लाह हसी चेहरा. This is the song from Kashmir Ki Kali which Mohammad Rafi has rendered for Shammi Kapoor.
ओह वंडरफुल वंडरफुल. मैं चाहूंगा कि सर आप नो योर डिपार्टमेंट में भी आए तो तब आपकी गायकी से ज्यादा परिचय हो पाएगा हमारा और हम सुन पाएंगे कुछ गाने.
Sure, we'll have a separate meeting for that.
डेफिनेटली. ओके, गेम ऑफ थ्रोन और हाउस ऑफ कार्ड?
House of Cards.
हाउस ऑफ कार्ड्स. केविन स्पेसी कमाल है. वेस्ट विंग की तरह से देखते हैं. ओके. एनी मैसेज यू वांट टू कन्वे टू एनीवन?
Message to be conveyed.
हाँ. एनी मैसेज यू वांट टू कन्वे टू एनीवन?
The message is always keep yourself in time, be communicative and be positive.
वाह
That's all.
वंडरफुल. नाइसली एक्सप्लेन सर. थैंक यू सो मच. आज से हमारे साथ प्रकाश सर जिनसे काफ़ी सारी बातें हुई, हम लोगों ने काफ़ी सारी चीज़ें उनके बारे में जानी, आप लोगों ने उनकी गायकी के बारे में भी काफ़ी सारी चीज़ें पता की और उन गायकी को आपने सुना. तो स्पेशली जब नो डिपार्टमेंट में सर को मैं लेकर आऊँगा तो दोबारा उनसे काफ़ी सारी चीज़ें हम जानेंगे. कुछ पोएट्री रिसाइटेशन भी रहेंगे, कुछ सिंगिंग भी रहेगी. तब तक के लिए प्लीज़ बने रहिएगा हम लोगों के साथ 90.4 मेगाहर्ट्ज़ कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी. थैंक यू सो मच. थैंक यू सर.
Thank you.